today the focus is on the state of health in our country. Frequent strikes, prohibitive medical costs and universal health care will form part of the discussion. To understand more about this, we have in studio with us Robert Shaw, who is a public policy analyst, and Dr. Mesha Kunguti, who is the former CEO of the Kenyatta National Hospital. But before I bring in my guests, on our typical question, we're asking you, are you satisfied with the state or with the provision of health services in your county? And some of your responses already coming in here. One says you have to buy the medicine, and at times mashini zimeharibika is what you're told, so you have to go to a recommended clinic. It is a sad state of affairs. We have Cordio Anthony, who says the health system in Kenya is broken. Universal health coverage is a scam. The state of public hospitals is dilapidated, but the government is busy with private hospitals and private insurance companies, and NHIF is not helping the common mwananchi. Do keep your thoughts and comments coming in. We'll be referring to them in the course of this discussion. All right, gentlemen, this is what we're discussing this morning. And as you can see, Kenyans already digging into the conversation. Let me begin with you, Dr. Onguti. This comes as the universal healthcare is a major agenda for the Jubilee government as we speak. What is your assessment, though, of the state of healthcare so far?
First of all, thank you for hosting us here this morning. Let us all accept that healthcare is dynamic, whether it's in Kenya or in other countries. And the levels of delivery of healthcare differs either from the high-income countries to the low-income countries or the middle-income countries, where Kenya now is in the middle-income country. When we talk about healthcare and its purpose in relation to what the government is doing, universal healthcare, what simply it means is that we provide we make healthcare accessible. Now, when we talk about accessible, it doesn't necessarily mean that just someone goes to the hospital and finds, he stays at a hospital. Mm-hmm. But we are talking about that when it's accessible, when the person goes there, he gets the services. That means he will get the specialists or the medical practitioners who are working in that particular place. And when we talk about medical practitioners, we refer to a team. Mm-hmm. We have got the nurses, we have got the other allied personnel, the people working in the lab and whatever we do. And I'm just mentioning this because you hear someone says, look, you went to the lab and machine imeharibika, which means that if one aspect goes off, then you don't look at the things in. Now, the other thing is that the reason why there's so much emphasis on healthcare is because once you have got the access, is it affordable? That means, can you get those services, that standardized care at that level at a very reduced, at a level of cost that you can be able to afford? Mm-hmm. Now, and you'll find that the reason why they say the healthcare is not very good in Kenya is because the costs of getting those services are far too high. Mm-hmm. Not mainly, and don't look at it in terms of the people who are delivering those healthcare, like the doctors or the nurses or whatever it is. But you have to look at it as a system, right from the top to the bottom. The other aspect is that the kind of work service you are giving is it of the recognized standards, what we call the quality. And is it efficient? That means they don't go to a hospital, to a place and stay there for a long period of time, 1 week, 2 weeks, or even hours before they get the treatment. Because by doing that, you end up making the place in place. So I would like us, when we're looking at this, that we look at it at that aspect. Remember, the main purpose for everybody is provide healthcare to every citizen of the country, to ensure that everybody who's sick, it doesn't matter. Even the disadvantaged, those who we feel are in the remote areas where there are problems in place. So this is why it's so essential that healthcare, whatever we talk about it, we must be able to change with timing. We must ensure that where we failed and assess. And the problem I find is that actually, although we have very good policies that have been put in place, mm-hmm. but we really don't have an organized system to tell us what is the best and what works and what doesn't work.
Right, and I'm glad you talk about policy. Let's bring in public policy analyst Robert Shaw. The Universal Healthcare Program is aimed at addressing the financial burden associated with healthcare, one that perennially drives Kenyans into poverty, affecting the economy at the same time. But the doctor here says we have great policies. What then seems to be the problem in implementation?
Yes, it's not just to do with healthcare. It's the biggest challenge that this government and many governments around the world have, is using what resources you have more effectively, and improving management and all of these things. Basically, governance issues, management issues, and I think that's one of the things about health here, is that if you were to look at the budget that is given for public health, but you will find, and you were to evaluate it and say, is the country getting good value for money? You would probably give it a marking of about 50%. So there is a lot of improvement within what we've got, and the reason I'm sort of coming that way is because we can't keep saying we need more money, because quite often the situation is the government doesn't have that money. So it's really a better use of those resources and motivating the people who are working there.
Dr. Nguti, I'd like to refer to one more tweet here that we read earlier that says the state of public hospitals is dilapidated, but the government is busy with private hospitals and private insurance companies. But what is the role of both the public sector and the private sectors in ensuring access to healthcare so we can consolidate the resources that we have, as Robert says, in implementing this?
Now, I think the mistake sometimes we make is that we think that the private sector does something very different in terms of that the healthcare they are giving is very different from what the public sector or the public hospitals are giving. Right. And that's the mistake. But let us understand that the purpose of both the private sector and the public sector is to do one thing: to make healthcare accessible and make sure that it's affordable to them and is of the quality that can be able to withstand the things in place. So what happens is, the difference is that if you look at it, most of the hospitals in the government are full. I mean, first of all, they're so overcrowded, mainly because they will hope that it's cheaper there than in private institutions, is because of the cost of the healthcare. Now, in private sector, and again, the problem that has happened is that I want to make this point very clear. What has happened with our healthcare? People have forgotten to look at it as a service of care. People look at it in terms, when they see how much, for example, the government allocates to that healthcare, they look at it as a business. And that business means that how much can they get from it? But they forget that that money is supposed to take care of the sick, to take care of those who need it, or even take care to prevent the diseases that will be able to cut down the overall costs of healthcare. So you find that the private institutions, what happens is actually, instead of healthcare going down, it goes up, because for every service they increase the prices of various things. That's the drugs, the tests. If for example that, and you remember these days that you used to have one situation where someone will have one condition, one medical problem. Right. But now you will have a patient with hypertension, for example, but you also have diabetes. Having all those kind of things. So what happened is that the tests have gone so high, and sometimes people think that it is actually the doctors or the nurses who have increased these prices. But if you went to find out in those institutions how much money they have taken in terms of increasing certain services, even in beds, in beds themselves, even in drugs, even in x-rays, even in cancer treatment, for example. All these things are the cost of healthcare in those private are very high. Now, in the public sector, the unfortunate thing is that, look, the government is supposed to provide all the essential elements of the drugs, everything that's supposed to be in place. But again, because of the very high demand, they are not available. So you find because you're not giving that, you're actually putting more people more into the poverty and more sick, and it becomes more expensive for you to take care of that particular aspect. So there has to be a paradigm shift in terms of how we look at these particular things. We have to look at it, for example, that look, if in the private institutions, their aim is to provide better services. Sometimes they spend a lot of time to do expansions, and this also goes to the government. If you look, for example, since 2013, if you look at the counties and you look at the national government, if you look, you can see there's been a fight who controlled healthcare. But in that fight, what are we achieving? We have actually lost so much. Because if we were all of us looking at it, look, how do we really make sure that we have health care accessible to those particular places? And in those fights, they have actually eliminated the stakeholders, the main people who actually do the services. Normally the clinicians, which involves all those, the team I've talked about, are involved last. And in fact, they have been looked at. But remember, healthcare cannot be there without those fellows.
Right, and we'll get there to
Yes.
who should be controlling
Yes.
what and what body really is needed to run the sector. But Robert, Sustainable Development Goal 3, ensuring healthy lives and promoting well-being for all. How far are we as a country from achieving that in terms of the disparities and inequalities that are being seen? The National Health Insurance Fund, NHIF, was meant to drive the universal healthcare agenda. It is on a campaign to get the much-needed numbers on board. But is that policy working as it should?
NHIF has a problem in that whatever that body says it's going to try and do, that's a massive task. So it is making a contribution, but in a lot of cases it's a very limited. It alleviates, if you like, some of the cost for a lot of people, but not everything. And that's the problem. When it comes, they don't foot the whole of the bill, and they can't do that. And they've also got some management and bureaucratic issues. So, I mean, at the end of the day, we have a situation where a lot of people have no choice but to go to the public hospitals, go to the dispensaries, etc. And when push comes to shove, they have to, in the end, even after any NHIF assistance, they will still have to fork out some money for something. And that's the reality.
Right.
We can make it sound affordable healthcare. It sounds wonderful, but we are not there. We've made a few steps that way, but it's still a long way to go.
All right, Dr. Nguti.
You see, the purpose of NHIF was supposed to take care of those vulnerable groups, the disadvantaged in the society, people who are not able to pay for their healthcare services. Unfortunately, again, those are the people who cannot be able to register because they do not even have a single coin to pay for those services, because they will decide whether they want to buy milk. And I say this because when we go throughout the whole country during our special service, for example, we find that actually people are very poor. I mean, they are very, very poor to afford even to take care of their healthcare services. Now, and unfortunately also the money that is the NHIF raises, the problem is that they give them to certain groups or institutions. Now, when you give them the institutions, who then have to see how they provide those services, you will find that what trickles down to that level is so minimal. In fact, you will find that in those hospitals, even the rebate from NHIF, those particular hospitals, is very low. Now, and then I have not seen NHIF involving the people who actually offer the services, because it will cut all these costs. Because see, if you engaged a team of, these days doctors don't work as a single modality, they work as a team. If you involve the team of, let's say, doctors, whether they are surgeons or they are obstetric and gynecology, that look, you engage them, that look, and you agree that, look, can you be able to offer these services, these are people who are in a particular area, they will do a better job. so long as you also promise that whatever is due for them, because you see, they must be able to be repaid for that. But you see, you give the money to those private insurances or private hospitals, for example, and they do not remit. You mean, in fact, it takes so long, they don't pay that money to the place. So it's from the word go, that process doesn't work on. NHI must be able to change the way they do things right now. And ensure that, look, they can insure people properly. And people, if the over-service are offered, actually more people will be able to insure with it. And now also, the effect is that, look, other insurances demand that you must have an NHIF
right,
so that you can give you services. Now, Kenyans are overstretched in terms of their resources. They are actually suffering, and that's why you find that every now and again they're looking for money to go to the hospital or buy whatever drugs are supposed to be there. The costs are very high up. I think the NHIF has to change in terms and engage the stakeholders more, not just one stakeholder, but that teamwork. So ensure that, look, where will our money be more useful? How do we protect it?
All right. I want to take a short break, but very pertinent questions there you raise, and it's very clear that universal healthcare is not free healthcare. Kenyans will have to pay for it in some way, either through taxes or, a payment scheme. We're asking you a multiple question today. Are you satisfied with the provision of health services in your county? Take a short break on News Center, but do speak to us. Our hashtag is KT.